Hello everyone, let's try to solve this question together. So which of the following is the true statement about CLABSI? What do you guys think? Which one is the right answer? Okay, the correct response here is B, that two separate blood cultures are needed for the diagnosis. So now let's walk through why the others are wrong. So let's talk about A. A says that a positive cultures from a central line is sufficient for diagnosis. That's not true. The reason is that, if you obtain a positive culture from the central catheter, it could be a contaminant. So you have to confirm it with the peripheral culture. So that's the clue here. What about C? CLABSI is slow in onset and could be asymptomatic. Again, the trick here is the word asymptomatic. For CLABSI, if you guys remember from our previous talk, that to have CLABSI, there has to be some symptoms prerequisite like fever, irritability, and some signs of infection has to be there. So it's not asymptomatic. And why D is not right? Because the word nosocomial means hospital acquired infection, which happens in the hospital. And we know that central catheter infection could happen as an outpatient setup. Many of the adult population, those who are on chronic medication and IV supplements, or even in pediatric population, those who are on total parental nutrition, they have the central catheter at home and it can get infected. So it's not completely nosocomial. So that was the wrong choice here. So now this is an important slide. So it just gives a dichotomy that what to do or how to interpret when you send two cultures. So easy answer is if both are negative, then we know that our suspicion of CLABSI is not there. So there's no CLABSI or no infection. You can even rule out infection. What about if if the peripheral is negative and your catheter culture is positive? So again, this is a possibility that there is some contamination, or it's a true just infection is just starting on the central catheter. But again, like it says as the asterisk down there, before you call it a contamination, the type of pathogen is very important. If you have a commensal pathogen, then you can probably suspect it to be contaminant. But if it's a gram-negative organism, for example, if it's Klebsiella, Serratia, or if it's growing Candida, there should be high suspicion of infection rather than a contamination. So just make sure when there is discrepancy between the two sites in the culture, always make sure the pathogen, what is the pathogen. Same goes with the third choice. If your peripheral is positive and your central is negative, again it's a possible contamination, and the same explanation goes like we explained before. Now what about if both are positive? If both are positive, you have to find out that what is the time to positivity. Is very important. If both cultures are growing in less than 2 hours, probably it's a central infection in the body. Just for example, it's endocarditis, and both cultures are becoming positive. But if the time to positivity is first, it is on the central catheter, like suppose within 2 hours, the central catheter is growing organism before the peripheral is growing and is a 2-hour window, it means this is CLABSI. This is classical CLABSI when both are positive and your time to positivity is faster in the centrally obtained blood culture. 2 points need special mention that sometime the cultures, they are saying that you have to obtain 2 peripheral blood cultures, and sometimes you have to obtain culture from 2 lumens. Again, the more culture you obtain, the chances of true positivity and false negativity has to be weighed in the process. So the ideal scenario is if you suspect CLABSI, of course 2 cultures has to be done, one from the peripheral and one from the central, and this is the interpretation guideline. If you guys have time, this is the reference. It's a nice reference on the internet which really talks about the diagnostic criteria, and it walks you through all the possibility. So again, I hope you guys have learned something together today. Please do check the CDC site as well, and we have a previous presentation on this topic. If you click this link, you can access that small presentation about CLABSI. So please do like and subscribe to our channel, and you guys have a wonderful day. Bye.